Asante. Governor Muthomi Njuki ambaye ni mwenyekiti wa afya katika baraza la magavana. Karibu sana Governor Muthomi.
Thank you very much, Your Excellency Governor of Nairobi. These are the moments I normally remind you went to school together when you do a good. Your Excellency, the President of the Republic of Kenya, who is also the Commander-in-Chief of the Armed Forces, the Deputy President, Chief Administrative Cabinet Secretary, and all the other Cabinet Secretaries, my fellow governors, all protocols observed. I stand here this morning with a very brief message from the Council of Governors because my chair will speak on behalf. Your Excellency, let me start by saying that this is a very defining moment given the fact that this has been tried 3 times before and we have failed all the 3 times. One very wise man from America, Albert Einstein, said that insanity is doing the same thing over and over again and expecting different results. Your Excellency, I remember during the Jubilee time, a government that we formed together, we had a push for universal health coverage where we majorly, and with a lot of emphasis, decided to emphasize on the curative aspect of the disease burden, where we pumped money into 4 counties and nothing came out of it. We are happy today because we've realized that the best way of tackling the problem is from the source, and therefore we are moving to a very critical stage of ensuring that we use our community health promoters, who are the front-line soldiers as the first line of defense when it comes with dealing diseases. Your Excellency, as Council of Governors, we realize that the Kenya Demographic Health Survey report, which is normally given almost every year, shows that we have been improving. All the health indicators are coming down. And we have realized that is the work that has been put in place by CHVs by dealing with the primary issues of the preventive health rather than wait to make long queues at the hospitals. And we want to thank you for partnering with us to ensure going forward this spread to every county in Kenya. One of the biggest issues, Your Excellency, around health is having a system which does not allow a formal referral system from the primary level to the highest level, which is the level 6. That most of our patients normally do what we call self-referral to the hospitals because they have no one to give them advice on where they should seek for help depending on their disease condition. And community health promoters are going to be key in ensuring that we have the correct referral system so that we can decongest our level 4, our level 5, and level 6 hospitals where the critically ill are required to receive this health without competition. Then, Your Excellency, we are happy that the laws that have been proposed, the 4 bills that are proposed that are before Parliament today, which have had very comprehensive consultation, and we want to confirm here today we are consulted as Council of Governors and we have given our input, are going to make sure that we have a uniformity in the whole of Kenya, where there is a CHV from Tharaka, Nithi, Turkana, Mombasa. They are going to operate under the same standards. That is one thing as a country that you should be proud of because no Kenyan will be left behind. Lastly, Your Excellency, you've heard the way the CHVs from Nairobi have clapped when the issue of stipend was mentioned. These people are going to play a very critical role in the season we are going, the season of El Nino. El Nino usually comes with a lot of diseases. It also comes with an environment that ensures that the diseases spread at an alarming rate. We are launching this at an opportune moment when we are expecting them to upscale what they are doing to make sure that we're going to have an El Nino with a difference now that we have an army to deal with our disease burden at the primary level. We only ask our governors who are dealing with this, my fellow governors, to ensure that we are prepared for the El Nino. And Your Excellency, there was an ask that there was a commitment to have a fund which is going to tackle El Nino, which is being coordinated from the national level. We ask that that fund to be able to find its way even to the counties where the El Nino will be taking place, and we'll be having a boost to be able to help assist these workers to be able to work better. Lastly, on the issue of the stipend, I will not be mentioning the figures here because the custodian of figures behind me. But Your Excellency, the 50-50 model works very well. However, when the gentleman from Nairobi, the CHV #1, stood up to speak, we observed a moment of silence because of the fallen heroes who went because they especially during the COVID, because they usually do a very risky job. And therefore, in that aspect of the stipend, let us incorporate NHIF. And NHIF is usually not paid monthly. It is normally a yearly contribution. And therefore, when we are paying for CHPs, we should be able to pay the NHIF upfront so that we can ensure that our CHPs have a health cover that is comprehensive throughout the year, even as we struggle with the stipend. With those few remarks, I want to thank the Minister of Health. I want to thank my fellow governors for ensuring that this is one area we have converged with ideas that are going to make this health space in Kenya have a difference. Thank you very much.
Asante sana, tumpigeni makofi. Kwa hii kazi tunashukuru Rais kwa sababu alitafuta marafiki. Na ni hao marafiki ambao wameweza kutusaidia kwa hii kazi. Asante sana mami. Asante. Unikubali nimwalike Peter Ndegwa wa Safaricom, lakini akija pia Deputy Governor wa Nairobi haraka usalimiane na utuambie kama kuna Deputy Governor